Hello everyone, myself Dr. Sarfraz Robert. I'm the IELTS and OET expert. Today I came up with another important video about the OET speaking sub-test. Today in this video I'm going to talk about one criteria which is called the linguistic criteria. Before I jump to the linguistic criteria, I'm going to introduce what is the OET speaking subtest. In the OET speaking subtest, our speaking is going to analyze within these two criteria. The first criteria is called linguistic criteria, and we have four linguistic criteria. What is the meaning of linguistic criteria? It means that we are going to be assessed according to the language we are going to speak with the patient within four criteria. So linguistic mean your language skills. Second criteria is clinical communication criteria. Here you're going to be assessed by how clinically you can communicate with your patient and listen to your patient as well. Now 5 criteria are coming in the second clinical communication criteria. Today's video is about the linguistic criteria. So we have 4 linguistic criteria in the OET speaking subtest. Now, the first linguistic criteria is called intelligibility. The second one is called fluency. The third one is called appropriateness of language. And the fourth and last criteria is called resources of grammar and expression. Now, I made one formula to make everyone understand how we are going to remember this linguistic criteria by if leg. I is for intelligibility, F is for fluency, L is for the language, and E is for the expression, and G is for the grammar. So that's how we have been studying even in our medical school. So this is the easiest way to remember and memorize that we have 4 criteria to cover in the linguistic criteria. Now I'm going to talk about each criteria in such way that you will understand what they are looking in your OET speaking test. When I talk about the first criteria, which is the intelligibility, now here examiners are interested to know that how clearly you can speak to the patient. Now, what is the meaning of clarity? The meaning of clarity is this, that how you pronounce your words, pronunciation. Pronunciation in the OET speaking subtest is going to analyze by 4 criteria. Number 1 is the stress. What is the meaning of stress? Means that if you want to know the diet of the patient, then you need to pay attention, or you need to stress on the word diet. If you want to know about the medication about the patient, then you need to stress the word medication. What kind of medications you have been using. So this is called the stress in your pronunciation. The second thing in the pronunciation is intonation. The meaning of intonation then, where you are softening your voice and where you're emphasizing your voice. The flow is called the rhythm. Like the speech has a flow that comes in the rhythm criteria. Accent is the 4th criteria, which is coming in the pronunciation criteria. For the clarity of your speaking, the meaning of accent is, are you easily understandable to the patient? Are you pronouncing, and are your style of communication is really understandable to the examiner or not? The second thing in the domain of clarity is delivery of your speech. Means that how easy it is for the examiner to understand you. If you are really convenient to understand by the examiner, then you are fulfilling the intelligibility criteria. Now, let us jump to the fluency criteria. The meaning of fluency, that the speed at which you speak. Now, many people speak really fast, many people speak really slow, but there are two things which in the OET speaking candidates are doing here, and the first one is hesitation. They hesitate when they speak to the patient. What is the meaning of hesitation? For example, they are taking time to respond. For example, they are going to talk and now they are thinking in their mind and they are taking time to speak with the patient. They are actually making sentences in their mind what to speak. So the time you are taking to speak is hesitation. Now, some candidates, they are self-correcting themselves. So by repeatedly self-correcting, they are coming under the hesitation criteria. Now, filler language. Many candidates in the OET, they talk like informal language. They use more oftenly, I mean, that's what I mean, like. So these are the style of your informal language. Basically, these things people use to fill their language to take time to think what they're going to speak the next sentence. Now, don't be a filler language person, be a fluent person in your OET speaking. Now, the third criteria is called appropriateness of language, mean your language appropriateness, that what kind of vocabulary you're going to choose and your explanation. Now, we have 4 parts under the domain of appropriateness of the language. The first one is called register. What is the meaning of register? Mean, are you using the informal language in the formal exam, or you're using the formal language in the formal exam? Now, many people, they use ine or gotcha or goina, so don't be informal in your speaking. This is coming under the domain of register part. The second thing is your tone. What is the meaning of tone? Let me make it a star of this criteria, because this is the most important criteria in the OET speaking sub-test. Now, the meaning of tone, that how you are demonstrating your emotions. We need to be emotionally intelligent, that if we are empathizing or if we are showing empathy to the patient, we need to soften or warmer our sound in order to show the empathy to the patient. Now, another part in the appropriateness of language is lexis. What is the meaning of lexis? Vocabulary. Now, you need to know where you're talking. Are you talking to a patient? Then you're going to say the word, I'm going to cut this area. You're going to use the word cut. You're not going to use the word incise. However, when you're going to talk to your colleague, you're going to say, I'm going to incise this area. So you need to choose the right vocabulary according to the scenario. The fourth thing in the language criteria is explanation of technical matters. You need to know that you are a doctor or a nurse or a pharmacist, but you are talking to the patient, whereby you need to use lay terms. For example, you need to explain your new diagnosis to the patient, the treatment, what is available, or the procedure, what you're going to do next. So you need to explain it in the lay term. Now, last but not the least is resources of grammar and expression. Here comes another challengeable criteria where majority of the candidates, they really perform poor, but one must know what they are going to check in this criteria. Range and accuracy of your grammar. What is the meaning of accuracy? Accuracy means how accurately your sentences are. Now, in the domain of the grammar, one must use different tenses. One must use conditional sentences, those sentences who are starting by the word if and one must really know the morals for advice. If you're going to advise, if you're going to give instruction, if you're going to talk about the possibilities, if you are going to do these things, you need to use should, must, can. Another important thing which is coming in the grammar is your words, vocabulary. Like if you are going to start your conversation with the patient, what kind of words you're going to use grammatically in your speaking. If you're going to ask some questions, how are you going to start your sentences? I'm going to teach in the upcoming videos as well how we are going to start our conversation, how we are going to ask questions, and how we are going to negotiate, and how we are going to recommend. Now, this is all about the OET speaking subtest linguistic criteria. Now, if you want to learn more about the OET speaking or OET writing or any module regarding the OET, feel free to communicate with me. Feel free to contact me on my WhatsApp number. If you want to join my online classes, I would encourage all the doctors, nurses, pharmacists, and physiotherapists to join my online classes. If you want to get your writing assessed by me, please feel free to communicate with me. I would like to help you and guide you and train you in order to achieve your B score in the OET test. Thank you so very much.